well, you better start planning for a pandemic. People don't even know what a pandemic is. So I think we will just kind of get down to basics and, what's the virus and what is a pandemic and how worried about it and what should I be doing now in order to help prepare.
Yeah, well, we really
questions like that.
Yeah, we really appreciate that, Dr. Ohl. Y'all need some more time, or?
All right, so the first thing, Christopher Ohl, O-H-L, is the last name, byline, infectious disease expert, Wake Forest Baptist Medical Center.
All right, Dr. Ohl, our first question is just, can you tell us what you want to get out to the public right now?
Well, I think that people are hearing a lot from the media about COVID or the SARS-2 virus, which is the virus that causes COVID. And there may be some confusion because maybe it's not so bad, maybe it's like a cold, or some people are saying, hey, we need to prepare for a pandemic. So what I thought, people should know that viral infections oftentimes have a lot of similarities to other viral infections. And so there's a lot of similarities between COVID and the flu. And so maybe it's worth thinking about it as like an influenza. So if you remember, in 2009, we had a pandemic of influenza that occurred. We first called it swine flu. It came out of Mexico, and it spread around the world fairly quickly. That's a pandemic. A pandemic is when all areas of the world are experiencing community transmission of viral infection. So we're getting close to that now with COVID. Almost every continent, except for Antarctica, is involved. And many countries now have community transmission, which means there's transmission of the virus, even with people that you wouldn't think of having any risk factors. So it's kind of like how the flu goes around in community.
So you said we're close to a pandemic. What would it take for it to officially be one?
I think a few more countries involved with community transmission would be something where the WHO would say that it's a pandemic. I think we're going to be living with COVID for a while, maybe a year or two. That's my prediction, and based on what a lot of experts are saying. And that I think that it's probably prudent for people to start thinking about it in that context. If you remember, back in 2009, it was a little bit disrupting when swine flu, that H1N1 went around. Schools were having trouble with absenteeism. Some schools had to close because they had enough infections in it. And when schools start closing, parents have to provide care. That means they can't go to work. More people are getting sick, and it means absenteeism at work is starting to go up. These are the things about pandemics that are actually the most problematic, is the disruption to our lives. And so we can kind of prepare for that now a little bit. In workplaces, for instance, could be starting to think about working from home programs, or how to help your employees get through times of illness. Maybe having the spectrum of your mission change a little bit, so the most important things are taken care of, rather than letting some of the other stuff go. These are all things that can be done. In healthcare, I would say right now probably every hospital in North Carolina is planning for a potential pandemic, and that involves plans for our own workforce, how to keep our employees, and our doctors and our nurses healthy, and for surge capacity to take care of more patients. So in a way, it's like a really bad flu year, and we just have to prepare for that.
So a few weeks ago, I know when we spoke, you had said you used the word minuscule to describe the chances someone in the triad would contract the coronavirus. Well, how would you quantify what you believe the chances are now with these updates?
So right now in North Carolina, I still think the risk is really small. I mean, we haven't really had any imported cases, and there's really been no evidence to us yet that there's any community transmission. So right now it's very small, and you definitely are more at risk of getting the flu than you are of getting COVID, because flu is still circulating. But I do think, though, that as time goes on, we're going to start seeing cases here in North Carolina. As the world outbreak expands and the geography increases, the likelihood of a case coming to North Carolina is high. And if that case is mild and a person thinks they have a cold, which is the symptoms, they may not seek health care or get tested, and then transmission can start occurring. So that's why this case in California this morning that you heard about is such an important development, because this is a patient who tested positive for the virus that causes COVID-19 and had no known contact, at least that we know of today, with another person who had the infection, which means somewhere there's a focus in and around that area in California. We haven't had that signal here in North Carolina. So right now, things are quiet. But I think as time goes on, you have somebody who just came back from Milan. Maybe they went to the fashion show. There's an outbreak now in Milan. So you have to start thinking about those things.
So a question that our viewers ask us a lot is, how long does this virus last in your body if you were to have one? And having it doesn't mean immediate death.
No. In fact, actually, the virus isn't incredibly dangerous for an individual. The infection itself, the incubation period is usually a few days. It can be as long as 14, we still think. And then the first symptoms are fever and cough. And the cough can be kind of nasty. And then for most people, it runs its course in a week. And it's done. A small number of people, about 15%, based on what we know from China, will go on to get viral pneumonia. And of those people, probably a fourth of them might need to be in an intensive care unit. So the highest risks for people to get severe illness are those who are older and who are infirm or who have other underlying diseases, particularly of the lungs or the heart. So they're the ones that are high risk. Right now, we think the mortality rate in all comers is probably 1%, maybe a little bit higher. We don't know until we have counted all the mild cases too. So the rate will probably go down some, but it's not the absolute severity in a single person that's the most worrisome for us in public health. It's the scope. So if you have 20 million, 40 million infections across the world, 1% is still a pretty significant number. And it's the increase in hospitalizations and hospitals trying to meet that surge of extra patients. Again, it's the disruptions to the normal way we live. Hospitals are already having trouble getting supplies to some extent. I think just about everyone in the country has had trouble getting masks and gowns and gloves, and so we have to develop ways to conserve those. And those kind of disruptions and supply chains are going to become more common as world transportation structures and such slow down. I think for the next few months, it's not going to be all that bad. Life can go on as usual, but at some point, it's possible that we have to start planning for disruptions in how we live because of this infection.
Follow-up question. So on the back of Lysol cans or the wipes, it says coronavirus on it. So some people have been asking, well, can't we just use these products to get rid of the coronavirus?
So Lysol kills a lot of viruses, and including coronavirus. The coronavirus that's on the can, though, is the usual coronavirus, is not the novel one. And yes, it does kill that. So it kills the viruses that cause the colds, and so it can be used on surfaces. I wouldn't spray it on yourself, because it's a little bit hard on tissues and things. But for surfaces, it's a good way to disinfect a surface. Will it work for this novel coronavirus? Hasn't been tested, but it probably would. I mean, most of the things that kill or disinfect viruses work against this. So soap and water, hand hygiene solution that's alcohol-based, these things will all kill these viruses, and so it probably also the SARS-2 virus.
The flu, for all intents and purposes, has a season, the flu season. Does coronavirus have a season?
So will the novel coronavirus have a season? We don't know 100% for sure. A lot of people think so, because these types of viruses tend to proliferate and last longer in the environment in cooler, low humid conditions, which is wintertime. So as the humidity goes up and summer comes around and the temperatures warm up, it may be that it'll blunt it. I think that it'll make it go away entirely, though, is a little more optimistic than true.
Just for comparison's sake, when you say that the novel coronavirus has a 1% mortality rate, how would that compare to the flu?
Well, so it depends on the year and which flu virus is circulating. Influenza itself is less than 1% in all comers, but for elderly people or people who have underlying health conditions, it's over 1% for severe influenza. So if you want to compare it to other pandemics of influenza, the big one was 1917, 1918, the Spanish flu pandemic. The mortality there was about between 1% and 2%, so about what we have now. And if you remember, that was pretty disruptive, even though the mortality wasn't incredibly high. Again, the scope was big. So.
When you earlier said that if this continues, I guess at the current rate that it is, that we could expect disruptions, what would you envision being a possibility?
Well, so the way we help, this gets down to how public health responds to widespread viral infections and potential pandemics, and how our pandemic planning is. Right now, we're doing what's called containment, where every case of COVID is identified, and then we draw a ring of contacts around those persons and quarantine them, isolate them. Once you have widespread community transmission, you can't do that anymore because it's out in the community. So putting somebody in isolation or quarantine won't have any impact because there's so many other people out there who already have it. So what we do then is we do something called mitigation, where we try to prevent spread of the virus by things like social distancing, which means when the virus hits your community hard, you may not be having basketball games or places where a lot of people get together. Church services could be curtailed, schools could be closed, daycare centers usually are closed, and things like that, to try to keep people from getting together. And that's usually done for a period of weeks until the surge of the virus through the community has abated. So, I'm not predicting for sure that that's what's going to happen, and it's certainly not in our near future, but it's something that could happen if a pandemic should occur. So what can people do right now? Well, the first thing is don't panic. We've actually lived through this, and to some extent in 2009 when the swine flu came through, and we all did fine, actually. And yes, there were some schools that got closed and some events that didn't happen, but it was short-lived, and it turned out it ran its course fairly quickly. So don't panic. Don't stockpile. There's no reason to be going out and buying 30 bottles of Tylenol, right? Because for the flu, when the flu comes through your house, you probably use 1 bottle of Tylenol for everyone, or you use decongestants or cough medicines, and you don't go through 30 bottles, so you don't need 30 bottles of cough medicine now. Masks. There's really no reason for the population to be using masks because the virus is transmitted by close contact with people who have the virus. And so when you're going through the airport, or you're walking down the street, or you're going to the mall, there's no transmission that's going to be happening to that extent. So there's no reason to be buying and hoarding masks or using masks. The mask works best if you are sick, and you put the mask on to keep you from spewing out viral particles out into the environment. That makes sense. But if you're not sick, you don't need a mask. I think the big thing is just make some planning. If for some reason the daycare center where Johnny goes to school, daycare every day is closed for 6 weeks, what would I do? Who would take care of my child? How would I get to work? Maybe I'd have to work from home. Could I work that out with my boss right now and have all that planning done? And so it's, again, the vast majority of us are going to get through this totally unscathed from a health standpoint. It might be annoying for a while, but it's really not, from any one particular person, it's not a huge danger. As far as travel goes, right now, there's certain places in the world I probably wouldn't go. If you could even get to China, it's probably not a good idea right now because they're still having a lot of problems. Northern Italy, I might avoid Northern Italy now. If you want to go to Italy, go to Sicily on the other end. South Korea right now, there's parts of South Korea where there's a fair amount of transmission. Seoul, not so much, but southern South Korea. So you can go to the CDC website and find out where their travel advisories are for right now. I get asked a lot about Japan. Japan's a level 2 advisory, which means take advanced precautions. Keep an eye on that. That might change. But as time goes on, and global spread probably will occur more. The places that are affected are going to increase, and you'll have to think about travel. If you're young and you're healthy, the risks are low. If you're older and have other diseases, it might be a good time to stay home and do the jigsaw puzzle.
These scenarios you talk about employers maybe thinking about prepping, basketball games maybe shut down. You don't really travel mornings.
Sure.
You don't hear this with the flu, the pandemic. You don't hear this with the flu. They're both viruses. Is it transmitted easier than influenza? Or?
It's probably about the same. The transmission risk maybe a little bit higher than the flu. For every one person who has this infection, it looks like probably somewhere between 2 and 2.5 people will get it from that one person. So it can move through a community fairly quickly, probably a little quicker than the flu. But you said you don't hear about the social distancing with the flu, and actually that's not true. We had social distancing programs even here in Forsyth County, Guilford County, and North Carolina for the 2009 pandemic flu that went through our communities. It never got quite to the point of severity or scope where we needed to implement those. But the plans were there. So we do plan for that for influenza, because influenza pandemics happen periodically, and that's still one of the things that we do to help slow its spread through the community.
And speaking of local planning, you said that you believe hospitals across North Carolina right now are getting ready, specifically Wake Forest Baptist Health. What is the hospital doing right now to prepare?
Right. So at Wake Forest Baptist Health, yes, we are dusting off our pandemic plans that we had developed in the past for flu. Most hospitals keep a pandemic plan, so we're looking at those and revamping them, and some things have changed since the plans were first written a few years ago, and we're starting to do specific planning for the COVID-19, and we're not doing it alone. We're doing it in combination and together with other healthcare systems throughout the state, and in cooperation and coordination with the state health department, and the county health departments will be involved as well. It's definitely it's a process of planning for this that takes a lot of people and working together, and that's what we're doing. I mean, we're already making the calls and getting everyone together to think about this.
Do you have any specifics? Because I know for the flu, some things that some hospitals did was restricting visitors 13 and under from coming to the hospital unless they were sick themselves.
Right.
So is there anything concrete that you can share?
Right now, no.
Okay.
I can tell you in general of the kind of planning that needs to be done by healthcare systems. Probably the most important one is surge capacity, and preparing for taking care of larger numbers of people with respiratory illness. So, and that's the one that can be a little bit sticky, and so because you're kind of limited a little bit by your facility and what you have. So, if you remember in 2009, I believe it was in Guilford County, maybe one of the hospitals there. I won't say a name because I don't remember exactly, but had put a tent up, outside of the emergency department to take care of additional people who are coming in because of the flu. So those are things that can be done. It also could mean repurposing rooms in your hospital from, instead of doing elective surgeries, you might repurpose some of those rooms for taking care of patients with respiratory infection. So surge capacity is the big one, making sure you have enough ventilators. Also working with your staff, nurses and doctors, and making sure that there's plans to make sure that patient care can continue to go on. So it's those sort of things. Specifics about visitor policies or stuff. It's a bit a little early to talk about that right now.
Dr. Roll, I mean, there are some nervous people, in our area right now. You wake up this morning and you see the news that there is a case confirmed in California. Just your personal reaction with all your expertise.
Yeah, well, I actually had figured it was going to be a matter of time anyway, so it didn't surprise me. And in fact, it's just sort of the natural progression how global spread of viruses go. So am I worried? I'm not worried. I don't worry for my own health or my family's health, really. I worry that I'm going to be busy, so I don't think people need to really be scared or that concerned, to tell you the truth. The reality of it is that there's more deaths due to influenza every year in the United States than likely there will be from COVID. And that's something you can do something about, right? You can get a flu shot and things like that. So.
And then my last question is just a few weeks ago you said that the earliest you would anticipate a vaccine being available would possibly be this summer. Do you still have that same timetable?
So Tony Fauci, who's head of the Infectious Diseases Institute at the NIH, I believe said yesterday that it's probably going to be 12 to 18 months.
And comparatively speaking to other viruses that spread like this, is it surprising or alarming of how fast it's spreading, or is it about like any regular virus?
So the speed that it's being transmitted is a little surprisingly high. Yes, And some of that probably reflects how our world has changed over the last few decades. So there's a lot more international travel, and we're more of a global society. Probably is reflected more by that, and how we have changed as human beings, and how we interact, than it is actually because of the virus itself.
And if there's, are there any myths that maybe you didn't mention that people should be aware of that you can debunk, or?
Oh yeah, there's a lot of myths about this. One of the most unfortunate ones is that Chinese origin people have been discriminated against a little bit, because people associated the virus with being from China, and that's not true. I mean, the virus doesn't discriminate. So right now, it's just as likely as you could get it from someone coming from Italy or Milan or some place like that. So there's really nothing specific about people of Chinese ethnicity that people should be concerned about. I hear, can you get it from Chinese food? No. I love Chinese food. In fact, I'll probably go get some after this. So you can't get it that way. I've heard a lot of people postulating that this could have been a biological weapon that was accidentally released in China. And I think that's been pretty much debunked, actually, because the sequence of the virus is of such that it isn't an engineered virus. Where this came from, more likely, is a little cute little mammal in China called panel, and because it very closely resembles that. And there's been a couple mutations in that virus that make it more easy to transmit to humans. So I really don't think it's an engineered virus. So if you have any other specific myths you've heard, I'd be happy to debunk them too.
I'm sorry, everybody, I do have one more question. You talked about ways that you can reduce the risk of contracting it. And you've also said that it takes about an hour of close contact to spread.
That's the party line, is that it's 1 hour of contact within 6 feet of a person. It may actually be a little less than that. And it also depends on the environmental surfaces. So if somebody's respiratory droplets have gotten on an environmental surface, such as a table, then it can persist there for a few hours, 12 to 24 hours or so, and you can pick it up then. So a lot of these transmissions actually occur from our hands. So you shake hands with somebody who has it, or you touch the surface that they were just coughing on, and then you rub your nose or you rub your eye, and then you transmit it to yourself. So frequent hand washing actually, just like it reduces your chances of getting the flu, are going to reduce your chances of getting this virus. The other thing we do for the flu is we try to avoid being around sick people. And if you're sick yourself, be a good citizen. Don't go to school, don't go to work. And that applies as the same for this infection. In fact, almost all of the things that we do to mitigate influenza as a person will work for this virus. The only one thing, we tell everyone to get a flu shot. I wish I could say that now for COVID-19, but maybe in a year with a little luck, we'll be able to say that.
Good.
Thank you, Dr. Wolf.
So the big thing, again, is background. I'm trying to reassure people. I mean, all this talk about life disruption is going to scare people, but it's something we've done before, and we can do it. We can come together and we can do that. I mean, you can miss a basketball game and watch it on TV, or there's all sorts of things you can do. Working from home isn't all that bad if you're asked to do that for 2 to 3 weeks. And so I think it may be annoying, but I don't think it's going to be to the point where people are really going to have their lives completely turned upside down.
Fortunately, for news, we got to be out on the streets, so.
Yeah, you guys are out of luck. Yeah, so
You think the Olympics are gonna happen?
that's a good question.
Should they? In your opinion?
I was just on the phone with somebody from Japan last night, actually. I think it's a little early to say. Actually, asked me that in April, but it's a little early to say. Right now, I mean, what's come up is about what the furniture mart and High Point Furniture Mart. I think I'm not really so worried about it from a health standpoint, actually. But I think economically, there may be a lot of people who have trouble getting to the Mart this year. I mean, no one will be coming from China. I doubt there'll be a lot of people coming from Japan because they're kind of busy right now dealing with this. And so attendance may be down some this year. But from a health standpoint, I don't think we're at the point where we would close the furniture mart just because of unless things really change in the next month or so. I don't think we're at the standpoint where we would close it for a social distancing reason, for a public health reason. Not at this juncture.